a genetic counselor. I have been working in the clinical genetic service for last 30 years or over. We introduced genetic counseling in the Kingdom of Saudi Arabia at King Faisal Specialist Hospital in late 1990s. As you know, genetic counseling is the core element of the clinical genetic service. Therefore, we need more counselors.
Genetic counselors empower patients and their families with genetic information, guidance, and emotional support to understand more about their family history, evaluate genetic testing options, and make informed choices for their future pregnancies.
The need for genetic counselors in the Kingdom of Saudi Arabia is increasing due to so many factors, such as the incidence of genetic disorders in the country, the implementation of the national programs of newborn screening and premarital screening, and the availability of the new era of the genetic testing like next generation sequencing, whole exome sequencing, and whole genome sequencing. All these factors require a qualified healthcare provider who is able to understand genetic information, genetic testing, and able to disclose genetic results in a proper way.
Genetic counseling is the process of communicating medical and scientific information to an individual or family with a genetic condition or birth defect. A genetic counselor can help people understand complex genetic and medical information and also help them to make decisions that goes with their reproduction and with their lives. How can we help the population as genetic counselors? We can help them by raising the awareness about the causes of genetic conditions, and also we can help them by help them find resources for the genetic information. We also can help them by making support groups for different genetic diseases.
In 1999, I started the first genetic counseling clinic. According to my experience, without genetic counseling services, the outcome for any prevention program will be very limited. Good example, premarital screening in Ministry of Health. The acceptance rate was only 8%. After I involved with Ministry of Health as a genetic counselor, and I start training the physician short courses and promote the awareness, gradually the percentage acceptance rate increased to 60%. I'm very confident when the new genetic counselor now services started will be exceed 90%.
I've been working as a genetic counselor for several years, and despite the rapid advancement in the field of genetics, we still have some challenges. First of all, the number of the expertise in genetics, including genetic counselors, geneticists, and molecular lab scientists, are limited in the Kingdom of Saudi Arabia. Second, the knowledge about the genetic disease among the public is deficient. However, there is improvement, but not to the expected level. Third, we do not have enough resources written in Arabic language that we could provide to our families. Then we don't have the support groups for our patients in Saudi Arabia. The Rehabilitation Center for Pediatric and Adult Patients in Saudi Arabia is not available. And because of these factors, we would like to initiate a project that could help our families to adapt to the medical and psychosocial aspect of the condition.
So far, we have about 20 genetic counselors trained and in place working in the clinical genetic service. Now we need to train more genetic counselors to work all around nationally in the Kingdom of Saudi Arabia.
Today I'm going to talk about 2 points. First is expanding of our genetic counseling services into Kingdom province That will reduce the burden of cost, financial cost for the patient and also for the healthcare provider. In line with that, we as a genetic counselor have a huge responsibility to minimize the sending our genetic samples overseas by finding a new way to collaborate with each other and find a proper local labs that can do our tests.
As a genetic counselor, I explain to the patients all the information they need and provide them with every kind of support to help them fully understand their condition, accept it, and help in preventing it in future pregnancies.
Genetic counseling helps population, provides information and support to people who have or may be at risk of genetic disorders through a healthcare professional who will investigate the problem, disclose the information and result in a perfect way and give the reproductive options to help them make the most informed choice about their condition.
We know Saudi Arabia is a tribal society. In Saudi Arabia, higher rate for consanguine marriage, which is account more than 50%. The main harmful genetic effect of the cousin marriage are higher frequently and higher morbidity and mortality among the offspring. The role of genetic counselor to provide information and to support the families affected by or at high risk of genetic disorder. It is also professional assessment of the parent risk factor regarding their family history or pregnancy. Not only risk assessment, but is also explain the cause of inherited disease, affability of the test, and prognosis management. It is also minimize the psychological and the social effect of this genetic disorder.
Genetic Counselor Awareness Day is a great opportunity to highlight the role of genetic counselors in promoting patient health care. On behalf of all genetic counselors in the Kingdom of Saudi Arabia, thank you for supporting and celebrating the Genetic Counselor Awareness Day.